There we go, official now. So welcome everybody who is on tonight. We're here to answer your questions about the conference. We don't have a formal program like we normally do, but we just have a lot of really great staff members here. They're not the whole conference team, but a big part of our conference team who put the conference together. And I'll go around on my screen here. So Dominga No is up there, and Joe Grima, and Susan Benvenuti, Stephanie Enger-Moreland, Lauren May, and Michael Weamer. So we're all here tonight to answer your questions. Well, the way we're going to do this is that, each person is going to talk about a little piece of the conference, starting from general registration, health fair, kids and teens, scholarships, and hotel. And after they just talk a little bit about their section, you guys can ask your questions about that particular topic. There aren't too many of you. You can raise your hand, or you can chat in the box if you don't want to speak, or you can just, if nobody else is speaking, then obviously you can just pipe up. That's why you're here tonight, and we want it to be informal. If there is noise in your house, Doug starts barking at something, just please put it on mute. And that's about it. At the end, we're going to have more time for more questions in case you have questions about a different topic that we haven't yet covered. And we'll take an hour. And if you have more questions after, we'll obviously be around to answer them. So we are going to start with Lauren with a little bit about general registration.
Awesome. Thanks, Eileen. Hi, everyone. I'm Lauren May. I'm Research Director at the Foundation, and I really hope I get the chance to meet all of you in Newport Beach in July. As Eileen mentioned, I'm going to quickly cover the conference registration process in case there's anything about that that's unclear. So everything you could possibly need to know about the E3 conference is on our website at marfan.org/E3 conference. If you don't jot that address down now, no worries. You can go to marfan.org and click on the video banner at the top of the page. It's impossible to miss now. And on that conference webpage, you'll find important conference-related dates. You'll be able to review both a high-level overview and a comprehensive agenda of what's planned for the weekend. You'll also get to see how much does it cost to attend conference, information about the hotel, and other important details about that weekend. So at both the top and bottom of that conference webpage, you'll find links to register for conference. Can't miss those either. Clicking either of those links will take you to an events page, and that's going to walk you through step-by-step the conference registration process. So just some additional information there. Once you're on that events page and you're ready to register, you click Get Tickets. Might not be the most obvious thing, but that Get Tickets is key to moving forward in the process. If you're an adult attending the full conference weekend, you're going to choose that adult full conference ticket. And the events page spells out exactly what's included with that ticket, which the general session, which meals, which special events, all that stuff. If children 5 to 12 or teens 13 to 18 will attend the conference with you, their registrations are free with at least one of those adult full conference registrations. We just ask that you register them and get tickets for them so that we know who's coming for the teen and children's programs. If you can only come on one of the conference days, we also offer adult registrations for Saturday only or Sunday only, so you don't have to miss out entirely. After you select your tickets, you're going to go through the process of entering information about each ticket holder, so you and anyone else you're registering. Then we're going to ask you to choose which workshops the adults are going to attend on Saturday and Sunday. And teens can do this too for the Sunday sessions. You can always change your mind about which workshop sessions you want to attend. It just helps us plan which conference workshops should be in bigger conference rooms. So, if you decide once you get to conference that you want to attend something else, perfectly okay. Once you've selected your sessions, you make your payment, submit your registration, and then you'll get a nice confirmation email that summarizes everything that you just took care of. The deadline for early registration is May 31st. After that, the full registration does go up to $450. And the last day to register for the teen and children's programs is June 13th, so that's an important one. Also on June 13th, that's the last day to book hotel rooms at the Via Newport Beach at the discounted rate. So as of a short time ago, we had, I think, about 320 people registered to attend, and we would love to see all of you in July. I'm happy to answer any questions about the general registration process before we get into other fun topics.
Does anybody have any questions about registration? Just really casual here, so.
You know, Lauren, June 13th is a very special day.
June 13th, is that a birthday?
Happens to be my birthday. So
Oh, that's wonderful.
just so you know.
I'm writing that down. I'm sending something in the mail.
Oh, I'm sure. No, that's a
Great
great,
day.
great update.
Yeah, thanks, Lauren. So there's no questions right now for Lauren. If you have some later, that's fine. But we're going to go to Joe now to talk a little about the health fair.
So hi, everybody. So health fair this year is going to be a little bit different than it has been in the past. That's because it's going to take place at the hotel this time. The reason for that is because of COVID restrictions at the hospital clinic. But we will still be having echocardiograms, eye exams, and pulmonary function testing on the Thursday when conference starts, July 7th. We still have room available if anybody wants a health fair visit. The health fair is mainly evaluations from multiple physicians from our professional advisory board. So if there are certain aspects of your medical journey that you want to ask about, you can fill out the health form application and send it to us online, and we will put you in for those examinations. Does anybody have any questions about that?
Okay. Well, if you think of any, as we're moving on, then feel free to put them in the chat, or we'll get back to more questions for Joe later. So now we're going to go to Dominga to talk about the kids and teens programs. And while she's doing that, I'm going to put the links to the programs in the chat box. Oh, wait, before we go, this question for Joe. What time should we be there for the health fair? That's from Sarah.
So if you are for a Thursday for echocardiograms, we're going to start them from 8 o'clock in the morning. So, you know, we are planning to run echoes from about 8 to 3. So we don't know the exact scheduling for everybody yet until we get all of the appointments together. So you should plan to be there, but you will get an appointment time approximately 2 weeks before the health fair.
Great, thank you. Any other health fair questions for Joe?
Christy had a question.
Yes, yeah, I told you we're gonna get to scholarships next, so we'll get to that in a minute. So, so Dominga, let's go over to the kids and teen program then.
Absolutely. Okay. Hi, everyone. My name is Dominga No, and I run our teen program here at the foundation. I have the privilege of being able to work with some amazing teens in our community. And alongside my colleague, Andrea Friedman, we are handling our kids and teen program for this amazing event coming up this summer. We have been working tirelessly to make a fun, safe, accessible, and inclusive program for our kids and teens. And it's really important that we ease any concerns that you may have going into this. I know it can be a pretty big deal. We're going to Disneyland, so this is awesome, right? So we want to make sure that this is a smooth and worry-free experience for you as much as possible. We are planning on taking everyone to Disneyland on that Saturday. We will get there in the morning at the park and have a really great accessible day. We also have a special space for lunch that we have organized for everyone with a few surprises at lunch that we're going to have for everyone, and then the rest of the day in the park. We'll come home back to all of you at the hotel for some fun that evening at a dessert social. Otherwise, we have a lot of great programming available both on Friday night and on Sunday to provide education and answer any questions that our kids and teens have. So it's a really packed weekend and a really packed program. So, oh, but most of all, fun and safety is our priority here. I don't want to speak too much for Andrea, but I think we're both in the same boat here, just wanting to make sure that everyone is having as much fun and safe fun as possible. So that being said, if you guys have any questions, we're here to answer them.
So are there any questions about the kid and teens programs? And Andrea's here as well, so.
I see a hand up, Mandy.
Oh, great. I didn't see it. Go ahead, Mandy.
Hey, so if there's kiddos that take medication during lunchtime that they would need while at Disney, is there going to be able to be someone to give them the medication?
Yes, we have, we will be sending out to everyone who's registered. So one quick thing, I just remembered a question that we're getting quite a bit is that how do I get my kid on the trip to Disney? Well, if you registered for your kid to go to conference, then you're already set, you're good to go. And from those registrations, we're going to send out some releases and some information to everyone. So if you do have medications that your child needs to take, you can fill it out on the forms that we'll be sending out, and that will let us know what we need to do. And then all you have to do is make sure that you hand those medications to the chaperones that Saturday morning, and we'll make sure that they get them at lunch.
And what is supervision going to look like about how many kids to what adults?
Yes, so the ratio for kids to adult, we have 4 children per 1 adult, and we're also encouraging a lot of our chaperones to double up, so it could be 2 per 8. And really it's going to be about and also Andrea and I are going to be there, but we're going to be floaters. So if any of the chaperones need some extra help, we're going to be there so we can give them an extra hand. And we will have a few other floaters as well that are going to be able to be there. Also, speaking of chaperones, we have some great chaperones that range from staff members of the foundation to beloved community members who have had experience in this program before. The Austin family, who have worked on our kids program for quite some time, are going to be joining us once again, and they're stoked. We also have some genetic counselors who will be joining us that have been vetted by Dr. David Liang and his team, so they will be joining us as well. Dr. Liang, I believe, will also be joining us, so we also have medical expertise at our disposal while we're there. And we also have some really great young adults who will be joining us with the teens, who either have a relationship with these conditions, Marfan, LDS, SPEDS, and related, or they have these conditions themselves. For those of you who don't know, I have Marfan syndrome myself, so I know the importance of accessibility, especially in a place like Disneyland. It's something that I want to strive for with this group. I'm going to be there with my cane, so I want to make sure that every kid has their magical experience, because I know that at a theme park it can be a little difficult, but we're going to make sure that that is as magical as possible for everyone involved. And I trust every single chaperone that we're bringing on this trip. I'm making sure that every chaperone I know and trust, and make sure that they will be joining us in keeping every child safe.
Yes. And if I could just add a few things to add to what Dominga said, all of our chaperones will have background checks done. So that's something that we take very seriously. But it's obviously, you want to make sure that your child is comfortable, and that you're comfortable knowing who will be on that trip with your children. So that's why Friday at the conference, the chaperones will all be there. You'll have a chance to meet them, and they'll get to know the kids. We have icebreaker activities. So it's not like they're showing up Saturday morning and then just going on this trip with strangers. So we're already going to start to build those groups on Friday. And then the other thing that I just wanted to make sure of is those forms that you will receive are really important, because we want to know if your child has mobility issues. For some groups, we might have a smaller ratio of the chaperone to the kids, depending on what the needs are. So we're just looking for you to let us know any possible concerns or issues, and we're making sure that we're really reviewing everybody personally, so that we can ensure as amazing a trip as possible. So so there's a lot of planning that's going into this.
But there's a couple of questions here for you guys. How many kids and teens do you expect? I don't know if you have an expectation or if Lauren has numbers.
So we are about 35 kids to 40 teens at the moment, and we're under the impression that that will continue to grow between now and the 13th of and now and Michael's birthday. So we're anticipating those numbers getting higher, and we will make sure that we adjust chaperones accordingly for sure.
And can we talk about the age groups? Because a couple of questions. Somebody has two daughters, 10 and 13. Can they be in the same group? And somebody else has a 13-year-old and an 18-year-old, and will they be together?
Okay, so 13 and 18, the answer is yes, because they are both in the teen program and they can have the opportunity to be in the same group. For the 10-year-old and 13-year-old, they will be in two separate groups and will be bonding with children in their own age group. So we are going to actually encourage and make sure that they are in groups with children their own age. That's really the focus. We want to make sure based off of those age groups that they're with children their own age, but they will still be in the same park. And if there is something that is needed, like I said, Andrea and I will be floaters and we'll be able to have them be in contact whenever necessary.
Okay, more questions, and these are definitely questions we anticipated. How can the kids and teens choose rides?
Okay, so my resident Disney expert, my younger sister Samantha Nell, and I are working on a very in-depth guide for all of our chaperones. We are taking every ride and rating it based off of accessibility, speed, velocity, all of those different aspects to make sure based off of to give sort of a red light, green light, yellow light ride system for all of our kids, and making sure that based off of accessibility, which ones our kids and teens will be able to go in or not go on. We will have it sort of be a very strict, this is a no ride policy, this is an okay to go on policy for all involved. We want to make sure that everyone can feel included and have fun on this process. So we want to make sure that they will all be going on rides that are safe for everyone.
And if I could also just add, at no time will any child be forced to go on one of the approved rides if they're not comfortable. So that's why we have some floaters, and we'll make sure that that somebody is there with the child waiting for the other kids in their group to go on the ride. So just because it's allowed doesn't mean that they need to go on that.
Absolutely.
Great questions. Anybody else have questions about the kids or teen program? I put the links in the chat so you can download the entire agenda for kids and teens from the beginning of the conference through Sunday. Well, if you have any additional questions, Dominga and Andrea are not going anywhere, but we will move on to a little bit about scholarships. And Stephanie.
Good evening, everyone. So scholarships. Christy, you had a question regarding the deadline that has passed. However, if someone is still interested in needing a scholarship, have them email me. We do have a wait list going, and I can send the form for a formal application. Scholarships should have received their answer on Friday, May 6th. I've sent a couple emails since then. They have gone to spam, it sounds like, for some people. So if you are awaiting an answer on your scholarship, please let me know. We had two variations of applications where you could have just your registration paid for, a registration and 2 nights of the hotel. And in that original email on Friday 6th, there was some information on when we needed to know by, which was June 1st, and kind of your next steps in terms of registering, your register code, and then registering for the hotel. We are aware of some issues with the hotel, and I've gotten in contact with a bunch of people, and we're still waiting word on that. But if you are a scholarship recipient and you haven't received any communication from me, let me know, because I've sent probably 2 or 3 emails out to all of our applicants regarding info on the hotel, just a friendly reminder, and then your formal application, whether it was approved or denied. And I see a hand.
Jody, go ahead. You're on mute.
Yeah, I just wanted to confirm, okay, because I am one of the ones that got a scholarship. So when I get to the hotel, that's when I let them know, right? Because the room is already booked.
Mhm.
And then when I get to the hotel, then I let them know to change the, what is it, like if they're holding my card until
So
I
we
get
will
there,
take that
right?
over. We'll take that
Okay,
over.
so-
Once you formally check in, we will meet
Okay.
with the hotel staff. And as long as, again, the name should match your application on the scholarship because we're going by those names. So we will go through with the hotel staff and move those 2 nights that you had applied for over to the foundation account. So
Okay,
if you are
so-
there any additional nights or incidentals, you would be covering that.
Okay, so then what I'm hearing is that when I check in, they probably already have a list of the people, or I'm probably gonna be already on the list, or I just tell them.
No, you don't tell them anything. We'll, after you check in after Friday or Saturday, Lauren and I will go through with the hotel staff and go
Okay.
line by line, name by name as to who will get moved over to the foundation account.
Okay, so I just check in like regular,
Mhm.
just check in. Okay.
But
sounds good.
Stephanie, Jody needs to make her own reservation, correct?
Yes, Jody, you would make
Yeah,
your own
which I already did, and I know they're holding it with my card.
Mhm.
So then because I was just wondering if we were supposed to say something when we check in, but now I know that when I check in, I just check in.
Mhm.
And then it just, you guys handle it on that end.
Yes.
Okay, sounds good. Thank you.
So I'm going to ask Lan to maybe clarify this question. The question in the chat box, they received an email about the hotel issue with 2 rooms, double or queen, for scholarship participants. I signed up with hotel and got confirmation. Is it sorted out? So I'm not exactly sure what that means. Do you get that, Stephanie, or should Lan?
I'm assuming it has something to do, has the 2-bedroom, the 2 beds in a hotel room been sorted out because we are sold out at the current hotel. I'm assuming that's what that is, and I do not have an update on that if someone else does.
Yeah, we're gonna talk about that in a second. Helene, are you there? Helene, do you want to talk about that while this came up?
It's just, I don't know, but I don't receive any kind of issue. So when I received the letter and I signed up for the hotel, and then I got the confirmation, I choose 2 queen beds, and they don't say anything, any issues. So I'm not sure is that I'm in the list or I'm not in the list. And then after that, I received email from Stephanie about just like for those who sign up and who want with the 2 doubles or 2 queen beds. So I'm not sure does it impact me or not.
Okay, so if you received a confirmation
Yes,
that you have a room with 2 queen beds, you are okay. And I will double check that, Lan. And I can email you because we do have a hotel list.
okay, sounds good.
But if you received a confirmation, that's what I'm assuming is that you did receive a confirmation that you got a room with 2 beds, which is what you wanted.
Yes,
Okay.
thank you.
So Helene is here. We can still take scholarship questions, but Helene can talk further about the hotels because there was this hotel issue with hotel rooms with 2 beds. So
yeah, I'll quickly just mention that we are sold out of double rooms, double beds, I should say, at the hotel for conference. But we just signed a contract with another hotel that's only 3 miles away. And so we have a number of rooms, double beds only for anyone who can't get double beds. And we will have that link. I just got confirmation. I will have the link tomorrow morning. And so that link will be shared with all the participants who still need to sign up for a double room.
And Helene, it's at the same basic cost as the other hotel,
It's
correct?
the same basic cost, correct. And I think it's maybe $10 more, or maybe even $5. you know.
And there's transportation, you said, right?
And there will be transportation to and from the hotel, so you do not have to worry about transportation. So everything will be taken care of. The VIA just doesn't have enough double rooms for us, so it's a Marriott hotel, which is great. So it's in the same family. And again, it's about 3.5 miles away from the conference hotel. And just so you know, for those of you that stay at the other hotel, what's great about the new hotel where the conference is at is that there is great space there that you can hang out at, you know, and relax at. And there are amenities there. So, but there will be a bus or transportation that goes back and forth.
So we're open for more questions. I don't know if Jody, if your hand is still up or you just didn't put it down before, but if anybody else has questions, there's several people here on this call, and those are the topics that we were starting off with, but obviously we're all ready to answer any other questions that you might have for us at the conference.
I have a question for the parking, because when we try to call the hotel, parking is $50 per day, and we rent the car, and it's just like, do they have the sponsor for the parking? Because if we park 2 or 3 nights, it will be cost us $150. Do you have anything for that?
I believe we have parking with our group contract at $16 a day.
Awesome. Oh, really?
Yes. So we will remind them of that.
Yeah, because we call the hotel, they say $50. Oh my
They
God.
the general people on the phone won't realize that it's something that we have to maybe either get we don't know how that will work yet, but we know it's in our contract for $16 a day.
Okay, so when we go there, do we have to let them know?
Yes, we'll let them know. You can let them know, yes, that you are with the Marfan group. Yes.
Okay. And the second one is that because we fly from Canada, so we have to fly early. By the time we get there, it's just like noontime, and they check in at 4, and then the conference start at 2. So we don't know what do we hang around, or just like we have to wait until the evening when it starts.
So what time are you?
What time? Because the check-in is 4 o'clock for the hotel.
Mhm.
And then the agenda and the conference, this is Friday, they start from 2 o'clock, and the official is in the evening. So I don't know. I don't know. So what time should we be there? Or if not, we can go outside and then until we have to wait until 4 o'clock to check in.
Yeah, I mean, you can get to the hotel at any time that you want and use the facilities. If you're checking in that night, you can leave your bags with the bellhop. If you'd like to go out and go out and enjoy the area until 2 o'clock, that's when our programming starts, and you can come at that point. You don't know when you get there, your room may be ready in the morning when you get there. So, when you check in, they'll let you know if the room is ready or not, and they'll inform you when your room is ready.
Okay, thank you.
Anybody else? You can either speak up, raise your hand, put it in the chat box.
I see Suzanne's hands raised.
Oh, okay.
Yeah, hi. Oh, I put a video on. I had to pull over to a parking spot. I'm on my way driving home from work tonight. It's the first time coming to conference with me and my daughter. And we had questions. Again, we're coming from Canada also, from the East Coast, and had questions about the health screen application. She's always got some great doctors here, but they are really open to, we don't quite know what to do for some of the things she's dealing with, and looking for this is the opportunity that can we connect with somebody who then they can potentially connect with and can do some consulting with, and we can work with our medical system to make that happen. My wonder is I'm working with ophthalmologists to try to get her health records so I can get them to you by June 1st, as well as for her, it's more dural ectasia and things like that that are a bit of an enigma to our team here. If her ophthalmologist in particular is just digging his heels in to give me her files, if I don't have them to you by June 1st, does that exclude her from the health screenings?
No, not at all.
Well, okay, that's a huge relief. Thank you.
Not
I
at
was
all.
really,
When you get the records, if and when you get the records, send them
Mhm.
to us. We'd like to have them early on so the doctors, we can make the files, plan the appointments based on what they need. So that's why we look for the records. So we
Okay.
can have everything ready. But if you
Okay, I will
don't have
keep-
them at that time, don't worry. You don't have to worry about it. It's just a way, because we know how long it takes to get medical records. So we want everybody to start that process early because we know it takes a long time.
okay, thank you so much. That's great to hear.
There's a question that came to me directly. I want to ask, because I'm sure everybody wants to hear this too. Are the meals provided for all conference attendees or only those staying at the hotel? I don't know, Lauren, Joe, you want to take that one?
I'm happy to take that one. If you are registering as an adult full conference registrant, you're covered for everything. If you register for Saturday only, you get the Saturday meals. If you register for Sunday only, you get the Sunday meals. It doesn't matter whether you live 5 minutes from the hotel or are staying at one hotel or the other. All of that is covered with your registration.
Great, thank you.
But you need to be registered for the
For the
conference.
full
For the
full
full-
conference
for the
or the
full-
Saturday only or the Sunday only. That's right.
And is there a list of speakers for the conference?
We do have a list of speakers that we are working on right now. That will be released with the brochure at the hotel. But they're mainly all of our professional advisory board members and other noted volunteers and people from different hospitals in actually California. We have some from UCLA, we have some from Cedars, we have some from all over coming in to speak. So we have a lot of people, a lot of different physicians that are going to be there as well.
And some of the sessions and speakers are being featured on our social media for the Marfan Foundation, for the Beds Movement, and for the Lower Seat Syndrome Foundation. So if you're on social media, you'll see some of those. Anybody else have any questions? I see Lan's hand is still up.
Eileen, there was a question. Eileen, I might have missed this. I'm sorry. Someone was asking about parking at the other hotel. I might have stepped away if you touched that one.
Oh, I missed that. Go ahead.
Yeah, great question. Whoever asked that, I will find out tomorrow. I do not know the answer to that. So thank you for bringing that up. I'm actually emailing them as we speak.
That's service. Anybody else on the staff get any questions, message directly to them that you might? Okay, just want to make sure.
Question just regarding the speakers, because I see so many good speakers and so many sessions that I like to attend, but the time frame is the same time. So my husband and I say, why don't we try, we split it, we still can attend all of the session. It's my first time and you just feel like you want to hear a lot, but I don't know. It's just like, I wish that they scatter some of them a different topic, but it won't happen. It's just like 1:30 or 4 something that saw the whole series. So do you guys do it the video or recording so we can watch later, or something that we can know, or can we jump between from half and then we jump the others?
Well, I'll take that one, because we actually on our YouTube channel have a lot of the presentations, not those that are going to be presented this year, but a lot of the basic information. If this is I lost you on here. Oh, there you are. If this is your first time and you're looking for some of the basic information, a lot of that, we've done webinars on that, and we do record those just like we're recording this one. For those sessions that are at the conference this summer, those will not be recorded. But we do have tons and tons on our website, and that just means you'll have to come back again. I mean, it's just so much information, and I know it's hard to choose sometimes. It's great that you and your husband can divide and conquer. But we have all that information in a lot of different places, and so to, I guess, prioritize this time and then come again.
So one more thing that every year, do you choose different location, or is usually I see that one year in Boston, and so every year it will be in different location, or it will be the same location?
No, those are different locations.
Okay.
Okay.
Thank you.
There's also a question here from Sarah. For the teen group, I have a teen that's a sibling of someone with beds. I'm not sure if there are any workshops that are pertinent to him. Is there something that he could do instead during that time? Dominga?
There are workshops that will be pertinent. We have a friends and family of chronic conditions that is meant for siblings that are not diagnosed to get their questions answered from specialists, and pretty much any of our other sessions are available and have information available to teens that don't have a diagnosis. We have a breakfast with the docs that is always pretty interesting, whether you have a diagnosis or not. And then we have a bunch of other sessions, including body image and self-esteem, which personally I think applies to anyone, whether you have a diagnosis or not. And then but the main one I would say would be for that friends and family of chronic conditions. That would be I think that would be very pertinent. So thank you for your question, Sarah.
So I'm going to throw this one over to Michael because this is a visioning question here. Do you know the conference of the location of next year's conference? Do you want to talk about that a bit, Michael?
I can talk about it briefly. We do not have contracts at this point in time going forward as a result of COVID. However, we are in conversation with our friends in Chicago at Northwestern and Lori about what kind of a conference we will most likely have next summer. So think mid-July, think Chicago, and I would guess in the next few months, there'll be some announcements coming out regarding the timing, the format, and the program. For sure, there'll be a health fair, so keep that in mind.
Great.
And then we're not sure where we will be going. So, Joe, I wanted to ask you a question though. I think part of the other question that was asked a while back, is there physician-to-physician collaboration after the health fair? I think that was part of that question was, do they have conversations or can they have conversations afterwards?
We can certainly, so when you come to the health fair, they will give you some written notes for you to take back to your physician and what they would suggest. If your physician wants to talk to one of the attending physicians, we can always set that up for you. And that's something really that Jan can do, Jan Lynch, our nurse, or during the even during the health fair, our physicians are very open to having other physicians call them and ask them questions and get advice. They're usually very good with that.
Thanks, Joe.
Thank you.
Going back to the chat, another question about if this conference is going to be live streamed, and if somebody can't make the conference and they're registered. This particular conference is going to be just in person. As I mentioned before, we do have a lot of webinars that we've done in the past. We'll be scheduling more for next year. We're also doing in-person symposiums. We just had one in Philadelphia. We'll have them in Seattle and Atlanta in the fall. So this particular conference, however, is going to be just in person. Lan has a question. How many participants do you expect? So where are we guys with that? I think Lauren reported on what we have so far. Hard to know, right?
I think she said 320.
I did say 320.
That's where we are right now. I know that the early discount deadline is May 31st. So we anticipate that will bump up a lot in the next 2 weeks. So
I'm estimating 513 based on my birthday and the number.
Great.
I think it'd be great if we get to 500. I think that would be great.
Yeah. And Lan, your hand is still up. Is that a new question or is that the same question?
It's a new question.
Oh, good. Oh, good. So glad you're here.
So many questions to ask. Yes, I'm talking just, I have 2 girls and one completely normal and one just still waiting for the result, is still doing the genetic test. So, but that's why, because we don't have any history with marathon in our family. So everything seems to be really new. So in the teen program, that is somebody asking, because my older one, the normal one, just keep asking, do they have anything for her? I said that they must be have something. But because one of the things I'm looking for, what's happened, that it turned out that the other ones have marathon and they need some kind of support, especially for sibling. And I'm not sure the program, will they have anything, just you guys are talking about that, because the one with the marathon, sometimes they still don't understand what it means at the sibling and how they can support. Just moving forward, we're not sure. It's just so many new things coming. It's overwhelmed. Yeah.
Absolutely, and that's completely understandable. So the great thing is we do have a connective tissue 101, which is going to cover Marfan, VEDS, and LDS, the basics. So that would be good for both of your children, I would say, for the one who is looking for their diagnosis and the one who doesn't have a diagnosis. I think that would be great for both of them, for both of your teens. And then also, as I mentioned earlier, the friends and family of chronic condition, that's a really great one, because that's really like a support group, as well as a space for siblings to ask questions and get the resources that they need in order to be able to be supportive of their family members.
Okay. Yeah.
If I could, oh, sorry, were you gonna say something else? I was gonna just add on to what Dominga said. I was just going to say that one of the amazing things about the conference is that even if there aren't specific sessions that fit, exactly what you're looking for, one of the greatest benefits of the conference is the connections that are made and the natural networking and relationships that are built. And so even after the conference, so many people stay in touch. And so your child who's not affected will most likely make friends with others, and they'll naturally share some of what they experience as being the non-affected sibling. So that's another thing that happens more naturally.
Yes, that's awesome.
That kind of leads to this next question. Jody was asking if on Saturday, are we on our own for dinner? And you are on your own for dinner. There's an incredible mall across the street, Fashion Island, which has all kinds of restaurants, small price ranges. But to build on what Andrea was saying, this is also a great time to connect with the people who you've met, people who you want to get to know better, people who you have things in common with, whether they live near you or far. And maybe they've gone through this before, maybe they're new also. So that little chunk of time on Saturday is for you to do what you want and meet up with whoever you want to meet up with or rest. We do have a dessert social that night, so definitely come back and hang with us. That will be fun. But yeah, Saturday night you are on your own. Just going through here. So Ramona, who's our big cheerleader, who lives in Southern California, sent a note just to if you saw that, hope you all saw this. I'm so excited for all of our participants that this is their first time. If you are on the fence, go. It's a wonderful experience. So she was not paid to say that. Francesca, Stephanie, this is for you. Can people from outside the USA, for example, from Europe, apply for a scholarship looking at next year?
Absolutely. Yep.
That was easy.
Eileen, this might be a good time to mention the International Patient Meeting as well.
Absolutely. So especially if you're in Europe, but if you're in the US and you want to travel to Europe, we are hosting an International Patient Meeting on August 28th in Paris. And that will be like a one-day symposium. A lot of the speakers who are going to be featured at our conference this summer will be over in Europe with us in Paris. It precedes a 4-day scientific meeting that we're also holding. But this one day is for patients and families. We have a hotel block, and it's actually free to register for this. Just have to get yourself to Paris, and we're gonna have a really great day. So we don't have scholarships for that, but it's free. So you're all welcome to come. So join us in Paris.
We do have a link for room rates as well.
Yes,
correct?
we do. Actually, that email is going out shortly, probably next week. It's going to everybody in Europe though. So if you're in the US, you can see more about that later. It's on our website right now, but we realize that California is probably a little easier than Paris and probably equally as attractive. So it's beautiful in Newport Beach. Can we join in Paris even if we are waiting for genetic results? Yes, absolutely. We don't ask for proof. If you're interested, you are more than welcome to come. Francesca, where are you located? Let's see, she's going to tell us where she is. Ireland, awesome.
Ireland.
Okay, great. I'll send you something after this today. So, any other questions? So everybody's registering? Great.
Let me just, you're going to wrap up here soon, Eileen?
Yeah, no, go ahead. Anybody else has anything they want to add, feel free.
Number one, I'd like to thank everyone for joining. This has been enlightening, fun, and hopefully helpful. I was also sitting here looking at the screen and I realized I hadn't really thought about it, but Susan, Lauren, Andrea, Stephanie are all brand new to the foundation and have never been to a conference, you know, and so as you probably can imagine, this is a massive undertaking, and Lauren has really been sort of our point person, or I should say our point person. Stephanie's been handling all the community related questions and scholarships. But anyhow, I'd like to thank our entire team. Dominga is an old pro at this, and Joe and Eileen certainly. Elaine's not showing herself right now, but Elaine's been around. But it's been an amazing effort, and the people that I mentioned that are brand new to the foundation are all in critical roles. So, and then we have new LDS, you know, we have new LDS folks, and we did have some vets folks at our Houston event, the last in-person event, but it will really be the first kind of VEDS channel related conference as well. So amazing night, and thank you to our team, and thank you to everyone that has attended. Let's get 513 people.
I'm putting the conference website in the chat again, so you can refer to that.
There's another question in the chat.
Oh, is there? Ray, I started my registration and got to the end and had to leave. How can I go back in to finish? I can't seem to get back in. I think Gretchen is here. She's hiding, but
Does Lauren know the answer to
Lauren,
that
do you know that
question?
one?
I don't know the answer to that one.
Dominga might know.
apologize.
Oh, look,
Dominga, do you know?
Dominga's take a stab at it.
I do. I believe I do know, and Gretchen, correct me if I'm wrong. I believe you have to you do have to start over, unfortunately. But it's a fun registration form. You can get going all over it.
And you're good at it now.
And Gretchen is also brand new to our team as well.
Yes.
Okay, if there's no more questions, then I just want to thank you all for joining tonight. I did put Stephanie's email in the chat. She is our go-to person, or she's our go-to person and your go-to person for questions on the conference. And obviously, you know, we're here for you, and we do hope to see you all in Newport Beach this summer. So thank you, everybody.
Good night, everybody.
Night.
Good night.
Take care.